On to the rest of the front page, and other allegations that are not going away about Rishi Sunak and private healthcare. Now, while the nation's health service is on its knees, as we all know, and ambulance workers are due out on strike on Wednesday, the Prime Minister keeps being asked, annoyingly for him, whether or not he uses a private doctor. Last night, he was grilled by Laura Kuenssberg, and one of the questions was whether or not he and his family had access to a private GP, which would cost about 250 quid a throw. And he refused to answer the question. Now, Nigel, it's very simple here. Why can't he answer that question?
Well, he can, and he certainly should. I mean, my own view is that if somebody's got money, they're entitled to actually spend it how they like. So if you choose, say, private education, that's a matter for you. I think Labour are right on that by saying, yeah, but the taxpayer shouldn't subsidise that choice. So on that basis, then private schools shouldn't have charitable status. If you choose to use private health, again, that is a matter for you. And indeed, that when it comes down to Rishi Sunak's medical conditions, that should remain private, no matter who he is. But we're not talking about a medical condition here. We're talking about how he organises his own healthcare for himself and his family. And he is the Prime Minister. He is in the public eye. It is a matter of public interest how that actually happens. And we deserve to know whether or not he's using private health, mostly because he's actually trying to organise a policy for the NHS. He had a big summit in Downing Street on Saturday to see if he could come up with some solutions. And I do remember Tony Blair getting in a pickle with this one. Tony Blair introduced a policy because whether he used a private doctor, I don't know, but Tony Blair certainly didn't sit in a GP surgery for a couple of hours waiting to see a doctor. He introduced a policy where a doctor's appointment could be got within 48 hours. What Tony Blair didn't realise, because he didn't use the service, was when the policy was introduced, you could only get an appointment within 48 hours. So if you had a minor condition and you wanted to see a doctor in 2 weeks' time, that wasn't possible. When Tony Blair appeared on television, I think it was a Question Time, and people who did use the National Health Service told him, look, this is not how it works, and it's not working properly, he changed the policy. Now, Rishi Sunak's in the same kind of position. If he's not actually using the NHS, but he's coming up with policy about it, this will influence the decisions he makes. That's why we have a right to know whether or not he uses a private GP.
Yeah, exactly. He can't hold out too long for that, will he? Mike says, good morning, Mike. He won't admit it, but obviously Rishi pays for private healthcare. Why would anyone put themselves through long delays for treatment, 6 hours in A&E, if they had the money to avoid it? But if he did experience those delays firsthand, maybe he'd be more sympathetic to providing the funding the service desperately needs. Now, Mike's right. Keep asking us your questions, everybody. What do you think about Rishi using private healthcare? Do you have a problem with it? Do you think it's absolutely fine? Or do you think it's a disgrace? Now, from my mind, Nigel, in a way, sort of just purely speaking from the media perspective, Rishi could make a virtue of this in a way. You know, he's got a multi-million-pound fortune of his own. He's married to a woman even richer than he is. And he could say, look, as Prime Minister on a salary of 150 odd grand, I pay national insurance on that salary. I pay more national insurance than most people do on that salary. I pay again and to see a private GP, and that takes weight off the NHS. It frees up appointments for other people. He could say, he could make a virtue of it, but it's the taxation thing that would trip him up on that, isn't it? Because he can hardly claim he's paying twice when we all know that his wife wasn't paying really what she should have done.
No, I think that probably shows the naivety of Rishi Sunak. I mean, when it was revealed that his wife had non-dom status and she changed it very quickly, it seemed astonishing that they hadn't thought about this. At the time when he was Chancellor, he was in charge of the nation's purse strings, in charge of imposing taxes on the rest of us. And it should have occurred to him that if it was revealed that his wife was not paying full tax on British earnings, that would come back to actually to hit him in the gut. And the same thing I think applies to this private GP thing. He needs to have thought about it. Now, it seems to me pretty clear. He obviously does have a private GP. If you're asked a question, do you use the NHS? Every politician I've ever known who does use the NHS has admitted that perfectly openly. So the fact he's being secretive about it makes me think, well, there's no question he has got private health care. And yes, you're absolutely right. You could make a virtue out of that. There's no reason why he shouldn't have private health care. He's a very rich man. His wife, as you say, is even richer. And he could argue that, yes, well, that will actually take the pressure off the health service if people who can afford to go privately did go privately. So it does seem to me a bit naive to be sitting there saying, well, I'm not going to answer the question, when in fact the answer it would not be too damaging to him at all. I don't see a problem why a prime minister shouldn't have money any more than I see a problem about a prime minister who's been on benefits coming in or whatever. And David Cameron used to say, I remember talking to him about this at a Downing Street party. David Cameron said, look, yes, I'm rich. I've got plenty of money. I've had a lot of privileges. But why should my background disadvantage my career? I thought that was actually a perfectly fair response. And the public, I think, understand that these people come from differing backgrounds. All Rishi Sunak has to be is honest about it.
Yeah, exactly. Now, Peter says the Prime Minister does have private health insurance. He doesn't want the NHS to succeed. Him and the Conservative government want to take us back to before 1948. It is arguable, I suppose, that if someone's background makes them so wealthy they don't have to use the NHS, that, as Nigel said, Peter, that the policies they make for the NHS, therefore, are going to be more likely to be illiterate than others to some extent. And if I was Rishi, I'd just be honest and say, yes, I do. And I'm trying my best or something. But, you know, the fact that none of us expect a prime minister to wait a long time for a GP appointment, do we, Nigel? Because, I mean, you know, when Boris Johnson had COVID, he was getting immediate health advice from Chris Whitty and Patrick Vallance, who were in the office at the time. You know, we would expect someone who's a prime minister to be able to get a GP appointment very quickly because that has ramifications for the rest of us. But I just would have to hope that Rishi, who's got 2 young children, you know, there's not a parent in this country that hasn't had an A&E dash at some point. And if woe betide Rishi, if he's got any kind of concerns for his children, he has to have a bit of a dash, and it's not to A&E, but to a private hospital, and it happens to be on a strike day, that would be a really, really bad look. And it wouldn't be terribly good. You know, if he has to use any kind of healthcare when the rest of the nation can't access their healthcare or people are dying, well, they're already dying in far greater numbers than they should be. People don't seem to have noticed. I don't know why, but the death rate's certainly up, and it's not just all COVID, unfortunately. Now, thank you for taking through all that, Nigel. Thank you for your comments, everybody. If you've got anything else you want to say about Rishi and his private healthcare appointments, whether or not he does have them, whether or not you care, whether or not it matters to how the NHS works for the rest of us, let us know.